Hi, this is Dr. Sampson Davis, and I'm here with my health and survival plan for you. So recently in the news, with the passing of the great float like a butterfly, sting like a bee, Muhammad Ali, I've been asked by many people in my circle, patients, about traumatic head injury and Parkinson's disease. And you know Muhammad Ali suffered from Parkinson's, and Parkinson's consists of the tremors. You see the shakes that a person may have, and they have a shuffled gait and a change in speech. Muhammad Ali was there physically in his mind state, but his physical performance rather was delayed and altered. So the question is, can repeated head trauma or hits to the head or blows to the head cause Parkinson's, or can it cause memory issues? And the true answer is yes. Recently there's been a study on CTE, which stands for chronic traumatic encephalopathy. And what does that mean? It sounds a lot of mumble jumble medical terminology, but CTE, or chronic, which is a long-term condition, traumatic, which is some sort of injury, encephalopathy, which means it relates to the brain, and a change in the brain structure occurs when there's repeated head injury. Similar to what you see in boxing with Muhammad Ali and other boxers, and what we have come to know in football with some of the more famous athletes like Junior Seau recently, who unfortunately lost his life by committing suicide. So with CTE, or traumatic encephalopathy, what we see is forgetfulness, we see impulsive behaviors, we see suicide, we see ultimately dementia. You see people lose the ability to remember things, and we see Parkinson's. So it is my opinion that Muhammad Ali did have CTE, or traumatic encephalopathy, and that he had early onset Parkinson's. We don't usually see Parkinson's developing until 60, 65. In Ali's case, the great one developed it when he was in his 40s. He probably has some genetic component to it, but definitely, without a doubt, there was some issues surrounding repeated head injury. So let me show you what a brain injury looks like. This is a picture of what it looks like when you're hitting the head. If you see this image here, and you see these two brains coming together, and what happens with that is that the brain moves in the skull, and it hits against the inner portion of the skull, and it's like a bowl of jello. That jello shakes. It doesn't lose its sort of texture, but it moves. It moves, and it's now not in the same position that it once was in. So it's tough, because I love sports. I love sports. I love football, soccer, boxing, MMA. I love all these activities, but the question is, would you let your child play? I don't know if I would. I don't think I would let my children play those type of sports that you see with the possibility of concussion. The truth of the matter is, I'm a big NFL football fan, but I don't know if I would let my son, I don't think I would, I for sure wouldn't let my son at this point suit up and play on the other side on the field against an opponent, because all it takes is a few injuries of the brain hitting the inside of the skull from a concussion, and you can later on in life, unfortunately, what happens today doesn't manifest until years from now. And I give it to the NFL, I give it to the sports for trying to take steps in order to minimize and mitigate the risk by having safety helmets, having redevelopment or restructure of the helmets, calling penalties for fouls when there's head-on-head collision. But the science doesn't know exactly how many hits does it take to the head to cause chronic traumatic encephalopathy. And unfortunately, the great Muhammad Ali lost his battle with Parkinson's disease. And he once floated like a butterfly and he stung like a bee, but in his untimely death, the bee stung him. And so the question is, would you let your children play? I know my answer. What is yours? Send me your message, let me know. Curious to hear your thoughts. Look forward to speaking to you soon.